But brisk January weekend in New York City. My mother was enjoying a weekend with her sister, her nephew, and her 16-month-old baby daughter. Now, fast forward 2 weeks to that same mother sitting in a hospital room at Johns Hopkins Children's Center with pediatric oncologists telling her that the same 16-month-old baby girl was no longer happy and healthy, but was actually knocking on death's door. Because they have just confirmed that her daughter Rowan had a form of childhood acute leukemia. Now, naturally, they didn't exactly use those words, but that's how the mother perceived it. So, today I'm here to inform you about childhood acute leukemia, the two major classifications, the signs and symptoms, and the tests performed to confirm an initial diagnosis. What is acute leukemia? I'm going to take these terms separately before I get into the entire acute leukemia phrase. What is leukemia? Leukemia literally means white blood. Now, Nancy Keene, in her book, Childhood Leukemia, A Guide for Families, Friends, and Caregivers, states that leukemia is cancer of blood-forming tissues that make up bone marrow inside of large bones. The leukemic cells in the bone marrow produce an overabundance of white blood cells and crowd out healthy cells. They then enter the bloodstream and affect other blood cells, such as red blood cells, which are used to transport oxygen in your body, white blood cells, which fight off infections in your body, and platelets, which are actually cell fragments that function to form blood clots, so you don't bleed out. Now, when it comes to acute leukemia, the term acute means that the leukemic cells develop rapidly and the disease progresses quickly. The leukemic cells develop in the bone marrow, enter the bloodstream, and then enter other parts of the body, such as liver, spleen, the spinal fluid, the brain, and if left untreated, can prove fatal within a few months. So now that we have some understanding of what acute leukemia is, let's talk a little about the two major classifications. The first classification of leukemia, acute leukemia, is acute myelogenous leukemia, or AML. Authors Dr. Harmon Eyre, Dr. Diane Lang, and Lois Morris in the book Informed Decisions state that AML arises from cells responsible for producing a group of white blood cells called granulocytes. And Nancy Keene in Childhood Leukemia states that 15 to 20% of all childhood leukemia cases are AML cases. Of those cases, 70 to 75% achieve complete remission with optimal treatment. The second form of acute leukemia is acute lymphoblastic leukemia, or ALL. The authors of Informed Decisions state that ALL derives from the cells responsible for making a type of white blood cell called a lymphocyte. In childhood leukemia, author Nancy Keene states that 75% of all children with leukemia have ALL. And the Leukemia and Lymphoma Society website states that ALL has a 90% survival rate for children under 5 and nearly 70% for children of all ages. While I hadn't planned on getting into any treatment protocols during this speech, because from experience I could tell you that we would have a much longer and complicated speech, I will tell you that knowing the difference between AML and ALL is very important when it comes to formulating a treatment plan for a particular child. So now that we've discussed the two major classifications of childhood leukemia, let's explore some of the signs and symptoms common to both. According to the authors of Informed Decisions, most signs and symptoms result from the shortage of normal blood cells due to crowding out of normal blood cell-producing bone marrow by leukemia cells. There aren't enough properly functioning red blood cells, white blood cells, or platelets. Many of the signs and symptoms resemble normal childhood ailments, but all stem from that one major underlying cause, acute leukemia. These signs and symptoms include, but are not limited to the following: fatigue and pale skin due to anemia, which is caused by a shortage of red blood cells in the body. Infections and fever, which is due to shortage of infection-fighting white blood cells. Excessive bruising or bleeding due to low platelet counts. Bone or joint pain, which is caused from the leukemic cells taking over the bone marrow and pushing outward on the bones. It causes extreme pain. And enlargement of the liver and spleen, which is caused from an infiltration of leukemic cells in these organs. Now, the 16-month-old baby girl that I spoke of in my introduction, she had every single one of these symptoms when she was diagnosed. So, now that we've discussed some of the signs and symptoms, let's move on to how it is diagnosed. There are three main diagnostic tests used to confirm an initial diagnosis of childhood acute leukemia. The first is blood cell counts and blood examination under a microscope. Abnormally low counts of red blood cells, white blood cells, and platelets is the first indication of acute leukemia. And examining the blood cells under a microscope, you can tell the leukemic cells are easily distinguishable from normal blood cells because they are larger, much, much larger. The second main diagnostic test used to confirm acute leukemia is a bone marrow aspiration. This is when the oncologist goes through back and drills out a piece of the bone marrow about this big from the child's hip bone and examines that under a microscope to check for cancer cells. The third main test is a lumbar puncture. The third test is the lumbar puncture, in which the oncologists go in through the spinal cord right here, spinal column, and draw out a sample of spinal fluid to check for leukemic cells in the spinal fluid. This is very important because the leukemic cells can enter the spinal fluid and travel up into the child's brain. So, today I have sought to give you information on childhood acute leukemia, the two major classifications, and the tests used to confirm an initial diagnosis. Now, as you may realize, everything I've talked to you about today is just the tip of the iceberg when it comes to childhood acute leukemia. But knowing these things may just help you save your child's life. Because the onset of the disease is so rapid, you never know when your child might develop acute leukemia until he or she does. I certainly didn't. For you see, that mother I spoke of at the beginning, that was me. And that 16-month-old baby girl was my beautiful daughter, Rowan. Today, she is nearly 3 years old, and although she still has a while to go yet in treatment, she is considered as being in remission and is once again happy.